Hello students, this is Professor Lopez and today we are going over fluoroquinolone antibiotics. This is another antibiotic in our series where we talk about the most tested upon medications for this category, not only for your nursing school journey but for your NCLEX. We're going to start off with how to identify a fluoroquinolone amongst other antibiotics, and that is that all fluoroquinolones end in fluoxetine. When you see that fluoxetine suffix, you need to make the identification that this is a quinolone. Whether it's ciprofloxacin, levofloxacin, or moxifloxacin, these are all fluoroquinolones. Your fluoroquinolones as well has the mechanism of action in which they target the DNA of the bacteria, thus leading to cellular death. This medication only targets the DNA of the bacteria in question. This does not alter anything with the consumer of this drug. Next, we're going to go over the indications of your quinolones. And your quinolones can be utilized for disease processes such as complicated urinary tract infections, respiratory infections such as pneumonia, bone infections such as osteomyelitis, and fourth, where I want you to bold and outline, and that is anthrax. Anthrax is an atypical disease process that is highly tested upon due to its utilization in bioterrorism attacks. And the fluoroquinolone of choice for anthrax is ciprofloxacin. So I want you to write ciprofloxacin is the antibiotic of choice for anthrax for the fluoroquinolone subsection. Next, we're going to go over the key side effects and adverse effects that can pop up on an exam. These side effects are usually the hot topic of select all that apply questions. So make sure you can associate which side effects belong to your quinolones. The first being the incidence for ruptured tendons. Ruptured tendonitis is a black box warning for your quinolones, specifically the Achilles tendon. The second side effect I want you to make note of is the incidence for QT prolongation. Your quinolones can alter the electrical conduction of the cardiac system. So ensure as a nurse that you are monitoring your client's cardiac system. Third, this medication can potentially alter glucose levels, so be very cautious with your diabetic population. And lastly, photosensitivity is a side effect, so educate your patient on the necessity for sunblock and protective clothing. To round up your quinolones, we are going to go over 5 key points for an exam. These are highly tested upon subjects for your quinolones, and I would highly emphasize you add them to your notes. The first being the suffix of your quinolones is fluoxetine. Again, whether it's ciprofloxacin or levofloxacin, if you can identify that suffix, you can identify this medication as a quinolone. Second, ciprofloxacin is an antibiotic of choice for anthrax. So again, fluoroquinolone, specifically your ciprofloxacin, is utilized to treat anthrax. Third, the black box warning for your quinolones is the incidence for ruptured tendons, specifically your Achilles tendon. Fourth is the incidence for QT prolongation. Your quinolones can alter the electrical conduction of your heart. This is only one of the 2 antibiotics, the second being macrolides. So quinolones and macrolides can alter the conduction of your heart. And last, photosensitivity can occur. So educate, educate, educate. Educate your patient to wear protective clothing and sunblock if necessary. That concludes fluoroquinolones class. If you enjoyed content such as this, feel free to like and subscribe, and I will see you at the next video.